Hospital leaders across Kansas now with more tools and resources to fight the surge of COVID-19 hospitalizations. This comes after Governor Laura Kelly declaring a temporary state of emergency in Kansas. KQ2's Madeline McLean sharing what that means and how it will help.
Some hospitals are breathing a sigh of relief after leaders across the Kansas City metro called for help, and Kansas's governor answered.
So first, let's just say thank you to Governor Kelly and to the political leadership in Topeka. That was a big step, and different than Missouri, where they've tried to declare victory, and which is obviously not true.
These leaders say they are seeing patient numbers explode at a time when hundreds of staff are out sick.
The most current forecast model includes a peak that actually doubles our current numbers by the early part of February. Now, is that going to be where we go? We don't know.
Answering the hospital's call, Governor Laura Kelly declared a 15-day state of emergency for Kansas, providing staffing flexibility and access to federal resources.
One of the big things we can do is take some different types of personnel, retired military, retired paramedics, retired nursing staff, and bring them back to help us run things. We can turn to the School of Medicine and School of Nursing. We're having those conversations and say, okay, folks, are there some people that can come over and help us in a swab, help us run our swab clinic or our vaccination clinic?
It also relaxes regulations so hospitals can focus on taking care of a growing number of patients.
When we have this emergency declaration, it does allow us to move those patients who are ready for discharge into a different facility much quicker, and that frees up beds for us.
While Kansas is getting some help, hospitals say it's time for Missouri's governor to step up too.
The truth is, there are a lot of people in Missouri who are getting sick, and there's not a lot of hospital beds, and a lot of the staff are getting sick.
And while hospitals say the emergency declaration helps, it's not the end-all answer to their problem.
The emergency order, that's going to help protect our community. You can also protect yourself individually, your bubble, your loved ones and friends, and that is by getting vaccination.
They also ask that we mask, avoid public gatherings, social distance, wash our hands, and get vaccinated. Reporting, Madeline McLean, KQ2 News.
Missouri Governor Parson declaring a state of emergency in the state back in March of 2000. It ran for 18 months before the governor allowed it to expire last week.